Hi everyone, I'm with a really nice patient of mine who had a clearview lens implanted at another office, and she had it just done in the right eye, and she had a major problem. She was getting ghosting and double vision with that right eye every time she reads. Can you tell us about how that double vision was?
It was blurry and also double, meaning, shadows. And the shadows went up and to the right, and they obscured everything. So I just couldn't see my phone any longer. I couldn't read anything.
And so the decision of what to do next was a little bit tricky because, one, she had a PCO, which means posterior capsule opacification, and usually the treatment for that would be to laser it. And when you remove that PCO, it makes exchanging a lens implant more risky. And so we didn't want to do that right away. So we blamed it on the lens implant because the clearview can cause ghosting with the near vision. And it's not so easy to fix. However, she did like her far vision. And so I did a little trick. Because the clearview has two segments, a far segment and a near segment, I wanted to see if she would read with the far segment, maybe that will get rid of the double vision. And so we took this lens. I had her read with that lens in front of her eye, forcing the far segment to do the reading, and all the double vision went away. And so that's why I thought maybe if we rotate the lens, we give it a shot, we see if the double vision or the ghosting goes away. And so yesterday, that's what we did. We took the lens, we rotated it 180 degrees, but before we proceed with the interview, here is her surgery video. And tell us how you're seeing so far.
Well, I'm still dilated a little bit, so there's some fuzziness, I think, attributable to that. But or I don't know, you would know better than I. But but like if I close my eye that hasn't been treated yet, I can read. A relaxing activity is to walk on the beach as the sun is going down.
And does it look double?
No, it doesn't look double. It's a little bit fuzzy still, but I can see, I can read it.
That's great.
I couldn't read.
Would you say it's better than before so far?
100%.
Okay, so that's cool. She still has a PCO, and I'll show you the PCO. It's not insignificant, but I'll show it to you. But so far, by rotating the clearview, it seems to have helped the ghosting. Now, the question I have is, well, would ghosting far now start occurring? You know?
We'll find out. I don't know.
Do you see any ghosting so far when you look far away?
Not really.
Okay, so this is my theory, and I don't know if this is correct. When you read something, you're reading high contrast, black on white print, right? That's where the ghosting is most noticeable because the contrast is so high. Now, when you're out and about, looking at street signs, looking across the room, things are not black and white. They're multicolored, and the contrast is a little lower, and maybe the ghosting will be less noticeable. but time will tell. So I'll let you guys know how she did. But so far, so good. We just spun the clearview 180 degrees, and it seemed to have eliminated her double vision.
It worked.
So good. All right. Thank you for sharing.
Sure.
Everyone, I've been following this patient for over a month now, and I just wanted to give you guys an update. And so her double vision did not come back. The IOL rotation with the near segment infranasally did the trick. But before having gag capsulotomy in that eye, she wanted me to perform her cataract surgery in her second eye. And so I did her second eye's cataract surgery also with the Clearview 3 lens, and I oriented the near segment infranasally, and she loved it. She's even doing better with that eye than her first eye. And so then we did the gag capsulotomy for the PCO in her first eye, and she's doing awesome. There are so many variables that can affect how a patient does with a lens, and so I wanted to share this video just to go through the troubleshooting process that I did when trying to manage her case. In my own personal experience, I feel that the Clearview 3 lens provides really strong, punchy near vision for patients to the point where I think they achieve 20/20 near or J1 plus near much more commonly than its competitors, such as the Odyssey or NV lens. But one of the risks associated with that punchy, strong near vision is ghosting when reading high contrast print. There are a few treatment options for a patient that experiences ghosting when reading with the Clearview 3. The first option is IOL exchange for a different type of lens implant. And I strongly considered this for my patient, and I think it would have been a very reasonable option to do so. The second option is to rotate the Clearview 3 lens. I felt fairly confident with this option because my patient passed the reading glasses test. The ghosting around letters resolved when I let her put on some reading glasses. Just putting a plus like 2 or 250, she said the ghosting has disappeared. So I knew that the orientation of the lens had something to do with the cause of her symptoms. The third option is a non-surgical solution. It's just putting reading glasses. I mean, if the reading glasses resolve the ghosting, then that is an option for patients who don't want surgery. Of course, they got the Clearview 3 lens thinking they don't want to use reading glasses, but if they got a monofocal and didn't have ghosting, they wouldn't be able to read anything. And so at least with the Clearview, there may be J1 or J1 plus, they have some ghosting, and to resolve it, if they don't neuroadapt, they can just put on some readers and that will go away. So that option is available for people who don't want to have any more surgery. Would I still use the Clearview 3 lens? Personally, every problem I've ever seen with the Clearview 3 lens was in a patient who did not have any cataract or had very mild amounts of cataract. So if they were getting a refractive lens exchange or they had barely any cataract and they get the Clearview 3, that could be an issue because these patients are used to perfect quality vision. And if you introduce some imperfections such as ghosting around high contrast print, that's going to be a major issue. So I would definitely caution its use in people for refractive lens exchange or very mild cataracts. Even the patient in this video, when I evaluated her, she had at most a 1+ nuclear sclerotic cataract, and I mean at most a 1+. But I personally have not seen an issue when implanting the Clearview 3 in patients with visually significant cataracts. I mean, it doesn't mean it can't happen. The lens position could be off a little bit, but I haven't had an issue with that so far, thank God. So I hope you found this video helpful. Thank you so much for watching. I'll catch you on the next one. Peace.